device manufacturers or people here that actually are involved with lasers?
Yeah, I would like to also delineate, because I've been a part of the 510K process. My name is Brian Maloney. I represent Arconia Medical. It's a manufacturer of low-level laser device. I'm their Chief Research Officer, and I've been for approximately 7 years now. I've been a part of the 510K process on numerous occasions, meeting with within the 510K parameters. For instance, in 2001, low-level laser therapy was granted the first 510K, which was for the reduction of acute and chronic pain of the neck and shoulder region. The last category claim created for low-level laser therapy was for non-invasive body contouring of the waist, hips, and thighs as determined by circumferential reduction.
Okay. When you market, do you market to other than chiropractic doctors or almost
Correct.
exclusively? Okay. So if you're going to market to a chiropractic doctor, do your reps take into consideration that perhaps contouring fat might be more within the scope of a plastic surgeon than a chiropractic doctor, or would you still provide a device to any licensee to sell a device?
It would have to fit in the scope of practice for that particular clinician. For instance, a cosmetic and plastic surgeon can utilize that device for cosmetic outcomes, purely for circumferential reduction. However, when we look at the chiropractic community and other entities, general practitioners or even internal medicine physicians, when we approach those particular physicians, we incorporate, and I do have with me several articles, the importance of adipose tissue when they become inflamed or enlarged, as it's referred to medically, hypertrophic state, enlarged fat cells. Now, when a fat cell becomes enlarged, it can have deleterious effects on the individual, the body itself. It can release inflammatory markers, which can give rise to chronic pain, as well as comorbidities such as diabetes and cardiovascular disease. So when we approach those particular clinicians, we try to fit the scope of practice. For instance, if an individual is presenting with chronic and acute pain that may be induced by the stress that the individual's weight is possessing or imposing on the individual's body, what we essentially do is we provide low-level laser therapy as a means to circumferentially reduce to support lifestyle changes, diet, as well as exercise. So essentially, I also have a peer-reviewed article with me that show that motivation is a fundamental element for ensuring compliance for any diet and exercise program. So if dietary changes and exercise is imperative for the individual, for instance, to reduce chronic pain as it may be present within a chiropractic clinic, we encourage Sirona to simply serve as an adjunct to help support the recommendations that one would make. That removes the cosmetic appeal, but simply serves as a motivation as the patient will generate circumferential reduction.
So you're saying that basically that you feel that if a chiropractic doctor helps somebody to reduce weight, that they would improve their health and be able to improve their
Correct.
ability to do that. Do you have any explanation to why I have never seen one advertisement from anybody doing this that talks about a person being able to go through the treatment phase and then stand on a scale and have a reduction of 1 pound?
So what's interesting is we have 34 billion adipocytes.
Have you ever seen anybody who's gone through a phase of treatment and who's actually been able to stand on a scale before the treatment, and then after the treatment stand on a scale and actually have a reduction in weight?
And when you say treatment, a series of 6 or after 1?
Whatever, because every single one that I've looked at, they talked about doing circumferential measurements and loss of inches, but they stressed that they did not assure any loss of weight or poundage.
So there will be a loss of pounds. Based on our clinical trial, it was not statistically significant, but there is a reduction of 1 to 2 pounds. And the reason being is we have 34 billion fat cells, which contributes only 30 pounds of weight.
I appreciate what you're saying. If there's a non-statistical loss of weight, and the primary focus of the advertisement is to lure a person in for a weight loss program, then explain to me why you feel that's appropriate.
That's not appropriate. That would be a misrepresentation.
Okay. So basically, the product that you sell does nothing to do really with loss of weight itself, but you're using it to enhance the ability for the doctor to talk to them about perhaps lifestyle changes and changes in their exercise and eating patterns. But still, we as a board will have to deal with the fact that some small percentage of doctors are expecting to get paid 70 or 80 or more dollars every time they do that and present to the patient that they're losing weight. And in your testimony, just to make sure I got it correct, was that it's at best very minimal.
As a standalone, correct. Now, coupled with diet, of course, there will be weight loss generated by the particular diet.
You know, every diet company does that. So,
correct.
But the machine itself doesn't do that, to your knowledge.
It will, based on our clinical trial, not be significant.
Okay. I'm sorry for interrupting you. Anything else that you...
No. So, with that, I provide a peer-reviewed published article that show that qualitative and quantitative changes in an individual's body will go a long way to sustaining motivation for lifestyle changes and dietary implementation. So if we want long-term, you can absolutely. Long-term success, it's imperative in the early going to demonstrate a quantitative and qualitative result for the individual so that they may maintain adherence to the program outlined.
Okay. I agree with you, and ideally, if we could help our patients with weight, that would be great. And as clinicians, that's one of our goals, is to improve people's overall health.
Correct.
Our concern is in false, misleading, or fraudulent advertisement or the utilization of a device inappropriately that compromises public safety.
Absolutely. And one thing that we can ensure is in every attempt is to go through the FDA clearance process that we have with them and the FDA clearance letter that shows that it's for the circumferential reduction of subcutaneous fat, and educate our clinicians to ensure that they respect and appreciate what the FDA clearance is truly saying, and that if it is a promotion of weight loss, that it is the diet that is implemented and not the device utilized that will promote the weight loss, that the device will simply serve as an adjunct to demonstrate the qualitative response in 2 weeks as determined by the level 1 clinical trial to perhaps motivate the patient to maintain the lifestyle changes implemented by the clinician for long-term health. And that's one thing that we continuously advocate, that this is not a device for weight loss, but it can be used in a weight loss program to help demonstrate the quantitative result that can motivate the patient to adhere to the program long-term.